Good morning. Thank you all for coming. My name is Nick Quealy-Gainer, and I'm on staff with Champaign County Healthcare Consumers, and I'm also the lead organizer for the Medicare Task Force. The Medicare Task Force is a group of Medicare beneficiaries and their allies that formed to fight for improved Medicare Part D prescription drug coverage and continues to advocate for social programs that support seniors in Illinois and at the federal level. While many seniors across the U.S. are experiencing anxiety about the possibility of cuts to Social Security and Medicare benefits from the ongoing budget debates in Washington, low-income seniors right here in Illinois are preparing for the real cuts to prescription drug benefits under a program called Illinois Cares RX. During our own budget debate this past spring, Governor Quinn proposed completely slashing all benefits under Circuit Breaker, which includes property tax relief and discounted prescription drug coverage for low-income seniors in Illinois, which is the Illinois Cares RX program. Members of the Medicare Task Force successfully fought to preserve funding to Circuit Breaker in the final approved budget. Unfortunately, funding for Illinois Cares RX was still cut by 50%, which will result in reduced and even lost benefits for over 200,000 seniors in Illinois. We brought you all here today to inform the public, particularly Illinois Cares RX beneficiaries, that these cuts are going to be going into effect on September 1st. Which is a little over 2 weeks from today. And we want to help people prepare for those changes to your benefits. But you need to act now. I want to introduce Jude Love, who's to my right, who will go into more detail about the program and the cuts to benefits for those who are losing their coverage or facing increased out-of-pocket expenses. After Jude, Connie Georgoulis will discuss the specific strategies to Illinois Cares RX beneficiaries that we really want to get out to the public so they can be proactive and attempt to diminish the impact of the cuts to their prescription drug coverage before they change up on September 1st. The Medicare Task Force celebrated the victory of preserving funding to Circuit Breaker and saving Illinois Cares RX from elimination. But we also recognize the devastating impact that the loss of benefits or increased out-of-pocket expenses for prescription drugs will have on thousands of seniors in just a few short weeks. We hope that the information that we'll share with you today, as well as the materials that we have distributed to the local libraries and have posted on our website, will help prepare seniors in Illinois for those changes. So, without further ado, I'd like to introduce a member of our task force, Jude Love.
Hello, everybody. I'm so glad you're here, and again, welcome. My name is Jude Love, and I'm a member of CCHCC Medicare Task Force and a beneficiary of Illinois Cares RX. Since 2005, Illinois Care X has helped low-income seniors pay their Medicare Part D premiums and co-payments and provide discounted prescription drug coverage, allowing them to avoid more expensive health care, such as hospitalization when they cannot follow their doctor's prescription drug regimen due to high costs and out-of-pocket costs. Beginning on September 1st, anyone currently enrolled in Illinois Cares RX with an annual income over 200% of federal poverty level, or with $21,780 for individuals and $29,420 for couples, will completely lose their benefits. This income limit is down from a roughly 250% of poverty level, which cuts over 40,000 seniors from this program. People who have been able to stay healthy and keep on top of their medications without worrying about high out-of-pocket costs will now be forced to find other means to afford their costly prescription drugs and Part D premiums and copays. Hopefully we can share some ideas with you today that will ease this transaction. For those still eligible for their copay will increase more than double for many prescription drugs. Generic drug copays will increase from $2.50 to $5, and brand name drugs will increase from $6.30 to $15. That's a 138% increase in the out-of-pocket expense for just one prescription. The average person over 65 uses 3 to 4 different prescriptions on the average, and the average person over 75 takes 8 prescriptions a day. Currently, the average senior covered by Illinois Care RX may pay as little as $10 or as much as $50 a month in copays. After September 1st, that amount will increase to as much as $120 per month for a person over 75 years old. That's going to affect me personally, and I budget down to $2 to $5 every month, and I live very, very frugal. So I want everybody to kind of in that mind. That's nearly $1,500 per year just to pay for their prescription drugs on an already fixed income. For most seniors, paying for multiple prescription drugs is a significant expense will only become more difficult to afford after September 1st. When people struggle to afford the out-of-pocket costs for multiple prescription drugs, even with the Medicare Part D coverage, they may be forced to choose between taking their medication appropriately or paying for basic necessities, rent, food, utilities. Some even try to spread out 30 days supply by skipping doses or splitting pills, which can have an adverse side effect on your health. I hope this information that Connie will share with you will prevent and alleviate some of the more devastating outcomes. Programs like Illinois Care RX keep people living healthy and independent lives, and that's very, very important to us. It's unfortunate that these cuts were made to an otherwise successful and effective program. We can't emphasize this enough. Take action now. There are still things that we can do to prepare for changes to your prescription drug benefits before they take effect on September 1st. Myself and others with the CCHCC Medicare Task Force will continue to fight and protect programs like Illinois Care RX, Social Security, and Medicare that have proven track records of helping seniors and others in need of healthy and productive lives. But that's a topic for another press conference. Thank you all for being here also. And now I'd like to turn it over to Connie.
Good morning. Good morning. And welcome from me too. My name is Connie Georgoulis, and I too am a member of CCHCC's Medicare Task Force. And my husband and I are beneficiaries of the Illinois Cares RX program. And I'd just like to say that this program has enabled my husband to continue without really a lot of hardship to take multiple prescriptions, which would have really put an economic burden on us if this program wasn't in place. So we personally can attest to how important and helpful it is. As we approach September 1st, when the cuts and changes to Illinois Care RX that Jude talked about will go into effect, I want to offer a few suggestions to support the thousands of older adults across Illinois who will be impacted by the cuts to their benefits. Now, I'd like to first say what those people should not do. Do not panic. Be proactive and make a plan. Don't wait until September when the changes will take effect. So, whether you are losing your benefits or your co-pays are going up on September 1st, now is the time for you to figure how these changes will affect your monthly budget and your health care, and prepare for these changes. Again, now, don't wait. Also, don't change the way you take your medication without consulting your doctor or a pharmacist. Avoid the temptation to skip doses or split pills to make up for increased cost for your prescriptions. Now, be proactive, and here's what you should do to prepare. Watch your mail. You may have already received a letter from Illinois Department of Health Care and Family Services or your Part D plan informing you of the changes to the Illinois Cares RX benefits. Some of you may have received termination letters. Others, a letter discussing the increases in copays. And still others may have received a second letter saying the first termination letter was incorrect and you're in fact still eligible. So, make sure that you save these letters so that you can refer to them or the helping agency can look at them. If you haven't seen a letter in the mail from HFS or your Plan D plan, but currently have coverage under the Illinois Cares RX program, then you should talk to the state or local agency which helped you enroll in the program to find out how your benefits will be changing on September 1st. Or if you just have questions and want more information about your benefits and eligibility, bring your letter to your local agency that is listed or attached to the letter you received, and in Champaign County, that is Family Service Senior Resource Center. Or come to us, to Champaign County Healthcare Consumers, and talk to Nick. He'll be glad to help you. Think back when you applied for Illinois CARES RX, and whether your income has changed. You may still be eligible. Talk to your local agency, such as Family Services, if you need to fill out a new application. Talk to your doctor or pharmacist. See if there are lower cost substitutes, such as $4 generics, or free samples of the drugs that you're taking. Ask for a 90-day prescription and fill it before September 1st, if you can afford it. This way, you can get the drugs at this lower price, at lower copay levels, that can last you perhaps through December, when the cost will go up. Which will last you through December and not wait till September to get them when costs go up. Research other programs that can help you lower your prescription drug costs. Prescription assistance programs are offered by many drug companies or are provided by charities. If you have a specific health condition and can help with copays, Part D premiums and drug rebates, go to rxassist.org to see if your drug is covered and if you qualify. Also, check out drug discount cards such as Needy Meds and the Illinois RX card, which both can be printed directly from the websites for your immediate use. Finally, if you have a Medicare Part D plan and are losing your Illinois CARES RX benefits, you have the opportunity to switch Part D plans from now till the end of the year. See if it's worth it to switch to a new plan and save money. Usually, you would have to wait for open enrollment, which will be October 15th through December 7th. This year, however, anyone who is losing Illinois CARES RX benefits can switch their Part D plans now. In closing, as thousands of seniors across Illinois face the looming cuts to their prescription drug benefits under Illinois CARES RX, Champaign County healthcare consumers and the Medicare Task Force hope that you will prepare for these changes and take action now. Be proactive. Don't take the cuts that Springfield or Washington or wherever are giving us. Be proactive. Don't wait until September 1st to make a plan, and know that there are other options and resources available to help you get through this difficult period. For most seniors, paying for multiple prescription drugs is a significant expense, and Illinois CARES RX will, and it was and will continue to be a program that allows people to afford their costly drugs. While we appreciate the fact that the program was not completely cut, we also recognize that the changes in benefits that we described today will have a dramatic impact on the lives and well-being of seniors in Illinois. If you need help in understanding these changes or preparing for September, contact CCHCC at 217-352-6533 or Family Service Seniors Resource Center at 217-352-5100 today. Thank you for your time. Now I'll turn it over to Nick to close the press conference. And please, for those of you affected, be proactive. Act now.
Here, here.